Good morning and welcome to the COVID-19 media briefing on November 17th. We will begin with Mayor John Tory. Go ahead.
Well, good morning. Our progress helping residents get vaccinated in the City of Toronto continues. I'm proud to announce today that we've reached another important threshold, that being that 85% of eligible Toronto residents are now fully vaccinated. Yesterday, we celebrated the fact that more than 5 million COVID-19 vaccine doses have been administered by Team Toronto. We're getting very close to our goal of 90% of eligible residents being fully vaccinated. I also want to recognize that, as Dr. de Villa can demonstrate, our vaccination progress as a city is outstanding when compared to other large, diverse cities around the world. That's a testament to the residents of the City of Toronto, that so many people have already stepped up to do the right thing, and it's a testament as well to the members of Team Toronto. There are hundreds and hundreds of them, and the tireless work that they have done to help people to get vaccinated. And that work continues. But I've certainly found it incredibly heartening to go, as I've done each and every week, to these smaller targeted vaccine clinics, the ones that we're now employing on the weekends, and see people coming in for their first dose and to talk to them about what moved them to do that and how they heard about it and so on. But they've decided, at the bottom line, that it's the right thing to do at the right time now for them to get vaccinated. And that's why we keep the clinics going, why we try to have new ones in different locations or locations that have worked week after week, and we keep highlighting the availability of vaccinations. We're not going to give up on helping people. It's good to know that every day a number of people still continue to make the right decision to get vaccinated, to help protect themselves, their co-workers, their families, and their city. That's why we now have 85% of eligible residents fully vaccinated, on our way to our goal of 90%. We always knew this effort would be a marathon and not a sprint, but together with our great team, I've always been determined to make sure that Toronto leads the way and leads among major global cities in terms of COVID-19 vaccinations. And that is why our work doesn't stop. We've vaccinated millions, and now we're working to help get the remaining thousands that stand between us and 90% to get them the best protection possible against COVID-19 as soon as possible. So I'm proud to announce as well today that we're launching the Vax the Holidays campaign. And this is all about making sure that we have vaccine clinics that are as easy to reach and as accessible as possible for those people who still need to get vaccinated, and that includes those wishing to get a third dose. It's about making sure we put the vaccines where people are actually going and where they're going to be during the holiday season. And it's not hard to know where people are going to be in the lead up to the holidays. They're going to be at malls and other places out in the community. So starting today and running through this weekend, we will have 14 mobile walk-in clinics operating around the city, in shopping malls, in community centres, in schools, and in places of worship. Anyone who needs a first or second dose, or for that matter a third dose, can visit these clinics, those who are eligible for a third dose. Operating hours and locations of these Vax the Holidays clinics can be found at toronto.ca/COVID-19. These clinics are on top of our 5 city-run vaccination clinics, the other ongoing efforts by our vaccination and health partners, and on top of as well the 450 pharmacies offering vaccinations across the city. Our 5 city-run immunization clinics continue to operate and do great work getting people vaccinated. So I'm also announcing today we're opening 11,000 new vaccine appointments for the 5 city-run vaccination clinics starting next Tuesday. And so those appointments will start next Tuesday and can be booked online as well in the normal manner. So people can book an appointment for first, second, or if they're eligible, third doses at any of these 5 locations across the city by going to toronto.ca/COVID-19. We're continuing to prepare for Health Canada's approval of the COVID-19 vaccine for kids aged 5 to 11 with our Team Toronto Kids COVID-19 vaccination plan. I want to thank the 43,000 people who responded to the survey run by Toronto Public Health and VaxTO about youth vaccinations. They ran that survey earlier this month. And I want to thank all the people that have been involved in putting together a plan that is constantly being refined and tweaked, but there is a solid plan there now so that we're ready to move as soon as this approval is given. The survey results have really helped us with this planning and refining this planning so that we can hit the ground running and be responsive to what people have told us. It's good to know that 66% of the respondents to the survey plan to have their children vaccinated. That is a good start. It does show that we have work to do to provide as much trusted information and reassurance to families that we possibly can about the vaccines and about their safety. Dr. de Villa will have more to say about that. But that's why as well that we have outreach teams with community organizations, our ambassadors, educational opportunities, public health professionals, including town halls and webinars, of which I believe there's even one being held today. We also know from the survey that most people prefer to have their child vaccinated at the child's school or at a doctor's office. And so Toronto Public Health is working to ultimately bring vaccinations or access to nearby vaccinations to all public schools across the city. The initial vaccine rollout will start with schools in the 30 Toronto neighbourhoods that Public Health has identified as a priority for vaccinations based on the data-driven approach that takes a large number of different factors into account. Hundreds of clinics are being planned to help the more than 55,000 children who reside in these neighbourhoods alone to make sure that they receive their COVID-19 vaccine. Dr. de Villa will have more details on the beginning of the children's vaccine rollout that has been so carefully planned. All of these clinics are being planned on top of course, the more than 110 doctors' offices, and that number is growing by the day, and the 450 pharmacies that offer the COVID-19 vaccine. And that is added, of course, to the dozens of fixed-site clinics, including the city's 5 major vaccination clinics. We want to help families get fully vaccinated so that we can make sure kids have the best possible protection as well against COVID-19, so that the schools, the kids will be safe, but so the schools will also be safer and remain open. It has, of course, been throughout the pandemic a top priority for us. And we also know that this will make a significant contribution to bringing the pandemic to an end, which has been our objective all the way through, and the subject of unending focus on our part. I'd like to now ask Dr. de Villa to speak about the Team Toronto Kids vaccination campaign, which is a top priority of ours at this moment.
Thank you, Mayor Tory, and good morning. You've just heard from the Mayor some of the details about the where and the how we will be vaccinating children aged 5 to 11 years old across the city. I would now like to talk about the why. Why should parents of young children get their children vaccinated as soon as possible? As the Mayor indicated, approximately 66% of respondents to our survey of parents and caregivers on 5 to 11-year-old COVID-19 vaccination are certain or very likely to get their children vaccinated against COVID-19 as soon as they're able to do so. While it's great to hear that the majority of parents and caregivers are ready and eager to ensure their kids have the best protection, the best tool we have against COVID-19, I know that there are some parents who have some questions. Today, I will address some of those questions, and I hope even allay some of the concerns that have been expressed. First, are the vaccines safe? Doctors and scientists around the world are confident in the long-term safety of the COVID-19 vaccines for several reasons. First, contrary to some of the myths that have been circulating, mRNA is not new vaccine technology. In fact, scientists have been studying and working with mRNA vaccines for decades and have found no long-term negative effects. You can also be confident in the measures and safeguards that Canada has in place. For starters, there is the rigorous study that Health Canada conducts in order for a vaccine to be approved for use in the first place. And even after a vaccine is approved and put into use, Canada's ongoing safety monitoring system ensures safety both in the short term and in the long term. So you can be confident in this process, as confident as we have been when giving any other vaccination to our children. I also ask you to consider the long-term risks of a COVID-19 infection, both for your child and for any other family members with whom they might be in contact. In the data submitted by Pfizer to Health Canada, the vaccine is reported to have a 90% efficacy rate in children 5 to 11 years of age. Vaccine also offers protection to children with chronic diseases and who are at risk for severe COVID-19 disease. Parents and caregivers may also worry about any side effects the vaccines may cause. At Toronto Public Health, we've heard a host of questions from parents and caregivers in the town halls and question and answer sessions that we have conducted to date. Clinical trial data shows that most COVID-19 vaccine side effects in children will be mild, similar to those for adults, and usually resolve in 1 to 3 days. Soreness at the injection site is the most common side effect, followed by some fatigue and headache. In the clinical trials, few serious adverse events were reported by participants, and none of these events were related to the vaccine itself. Vaccines do not impact fertility. They do not impact genetic material or DNA, and they do not impact hormone levels. It's true that myocarditis and pericarditis have been observed in youth and young adults, particularly amongst males, following the administration of mRNA vaccines. However, the National Advisory Committee on Immunization characterizes these as rare, occurring in 0.01% to less than 0.1% of vaccine recipients. Public Health Ontario has indicated that the reported cases of myocarditis and pericarditis following mRNA COVID-19 vaccine administration is 24.2 per 1 million doses of vaccine administered in Ontario. They also report that most cases of myocarditis and pericarditis in Ontario in 12 to 17-year-olds see symptoms improve quickly with rest and treatment. Compare that to a recent estimate from the United States, which indicated that as many as 450 in 1 million young men aged 12 to 17 develop myocarditis or pericarditis following COVID infection. To date, no cases have been observed in pediatric clinical trials with 5 to 11-year-olds. But all the same, this will be closely monitored in children. What can cause long-term impact on a child's health and the health of the other members of their household is contracting COVID-19. We now know that the virus can cause long-term damage to the lungs and other organs, as well as many other complications. This is called post-COVID-19 syndrome, or long COVID, and it's one of the reasons why doctors across the globe recommend getting vaccinated. The best protection against COVID-19 is for everyone in the household to get vaccinated, and this holds true for children 5 to 11 years old when the vaccine becomes available for them. Toronto residents, as you've just heard, have shown their commitment to vaccination and the protection that it provides. We should be proud, Toronto should be proud, that we have reached the milestone of having 85% of those who are eligible having received 2 doses of vaccine. As the largest in Canada and the 4th largest in North America, Toronto has the highest fully vaccinated rate for its entire population when compared to other major metropolitan centers, such as New York City, Los Angeles, Chicago, and London, England. So when vaccine becomes available for 5 to 11-year-olds, let's ensure that they too have the best protection against COVID-19. It's the best protection for them, for their friends and their families, and for our community. This is really the best way that all of us can return to the many aspects of life that we have missed so much since COVID-19 became a part of it. With that, I'll now turn it over to Lavin for the questions.
Thank you, Dr. de Villa and Mayor Tory. We will now take questions from the media. As a reminder, it's one question, one follow-up, and when we do say your name, we'll unmute you. So Alex Bloomfield, you're up first. Go ahead. Alex? Alex, can you hear us? Okay, we can come back to Alex. Next up, we'll do David Ryder. David, go ahead.
Hi there. First question for Dr. de Villa. I'm just hoping you can tell us a little bit more about the stat, about the 66%. Is that a scientific survey or online where you can get non-scientific results? And are you concerned because I had seen previous reports about 70%, so that seems a little lower than I think some of us were expecting.
So thanks, David. I can tell you that the survey was conducted online, and with the support of our remarkable epidemiology team at Toronto Public Health, I know that the data have been carefully reviewed and cleaned. I'm not going to get into all the details, but suffice it to say that we're quite confident in the results thus far. I think the 66% actually represents quite a solid start, and it is not dissimilar to that which we saw for adult vaccinations. I think the other interesting component to note as well is that over the course of the adult vaccination campaign, we saw that with continued efforts and with the actual proof in the pudding, as it were, actually seeing the vaccination get rolled out and seeing the benefits of the vaccine and, the good experience that people have had with respect to vaccines, I anticipate we'll see a very similar kind of pattern with kids. We saw reduced vaccine hesitancy over the course of our adult vaccination campaign. We saw the numbers come down. I suspect that we may see the same thing here as we will apply all the lessons we've learned over the course of the entire vaccination campaign to this latest aspect of the campaign, the 5 to 11-year-old vaccination effort.
Thank you. My follow-up, I think, is also for you, Dr. de Villa, and that's we're hearing talk of an 8-week period between first and second doses for young kids, which even if it started today, would take us well into January before a lot of these kids were fully protected. Do you have any update on when you think the approval will come, and when would we see Toronto kids, as many as possible, be fully vaccinated?
So, David, the last I've heard is probably the last that you've heard as well. We heard from Health Canada, I think, towards the end of last week, suggesting that approval was 1 to 2 weeks away. That's the latest information I have, and I know that we are all eager to get on with vaccination, knowing the benefits that this will provide to our 5 to 11-year-olds. Again, not rushing Health Canada. We want to make sure that they're doing the job properly. We want them to do their, to dot all the I's and cross the T's, as I know they will, recognizing that we will be ready here on the ground to ensure that once the vaccine is approved and available to us, we're ready to go, as are the many Team Toronto vaccination partners, to get that campaign up and running in an efficient and effective way, and in a way that actually meets the needs of our community.
Thank you. Next up, we have Mark McAllister. Go ahead, Mark.
Good morning. Dr. de Villa, you just referred to the campaign to try and get these children vaccinated. That campaign has already started, as you had mentioned. What more can you do, will you do, to try and raise that 66% number that you've told us about?
So, Mark, you're quite right. The campaign has already begun in earnest. Certainly, offering remarks such as one component to that. We have a number of resources available on our website, certainly for people to use, whether we're talking about individual families who have 5 to 11-year-olds in their midst, or people who provide care and services to this population. Resources are available to answer their many questions. we're holding town halls. We have question and answer sessions. We have this remarkable group of community ambassadors and vaccine engagement teams. And we have our providers all throughout the city, whether we're talking about the over 100 family physician and practices that are out there. We have Ontario health teams. We have pharmacies. We have hospital partners. And of course, we have our Toronto Public Health staff, both in fixed clinics and in mobile clinics. Lots of opportunities. Our school boards have been remarkable partners in this endeavor as well. So this is just a high-level summary of all the people that are actively engaged in making sure that parents and caregivers, and yes, even 5 to 11-year-olds themselves, are aware of the benefits of vaccination, that they have venues to have their questions answered, you know, we just want to make sure that people know that we're ready and that we are eager to help them get vaccinated in a way that makes sense for them so that they might be able to have the protective benefit of vaccine as so many of us enjoy now in our city.
So eager and ready is one thing. As we know, when vaccinations first started to become available for adults, there was supply issues. And despite the fact that the city was ready, eager, and waiting, what do you anticipate this time around, and what have you heard about potential supply?
So, you know, as you've heard before, when it comes to supply, a vaccine is actually procured by the federal government, distributed to the province, and the province is in turn responsible for distributing to the local jurisdictions and to the various vaccine providers on the ground. The latest that we've heard from the province is that supply does not appear to be an issue and that we anticipate having more than enough supply to meet demand at the outset of the campaign once vaccine is approved and once it's actually available on the ground for administration. So we're thankful for that, and we're looking forward to actually getting on with the 5 to 11 vaccination campaign.
Thank you. Next up, we have Christina Tinalia from CP24. Go ahead.
Hi, Dr. de Villa. Hi, Mayor Tory. On vaccinating children, we saw this when adults were being vaccinated here in the city of Toronto, particularly at the beginning of the vaccination campaign. People coming out, protesting, harassing those in line, making people uncomfortable, particularly making comments to them and making Torontonians feel badly about bringing their children with them and any concerns related to their children. We have seen comments related to, you know, vaccinating your children is a crime and those kind of comments. How are you going to ensure that parents can get their kids vaccinated safely without this kind of harassment, which could be a deterrent?
So, Christina, thank you for that question. You know, I have to say this, you know, while I appreciate that, you know, in a great city like Toronto, you're going to get a wide variety of opinions. I'd like to think that we respect that other people have different opinions, and we allow people to make the choices for themselves that make sense, whether it's for themselves or their family members. Certainly the science supports the benefit of the vaccines. I've tried to outline that today, and certainly for those who have further questions, there are all kinds of resources available on our website outlining the many benefits to vaccine, what safety procedures are in place, what kind of you know, rigorous process a vaccine needs to go through in order to be approved. This being said, I recognize that some people have yet to be convinced of the benefit of vaccine, and they are certainly entitled to make choices for themselves. I would ask that you know, they allow people to to respect other people's autonomy and personal choices. You know, while you're entitled to have a difference of opinion, that shouldn't impede other people from actually exercising their own individual right to choose based on the information that they believe makes the most sense to their families. That being said, we always do try to make sure that we provide not only a fun and positive experience at our vaccine clinics, part of that is also ensuring that we have a safe environment. So that certainly is part of our vaccine planning. I'm not going to get into the details here, but suffice it to say that we do have appropriate plans in place to ensure that people in our clinics experience, have a good experience in our clinic, and that includes a safe experience for those who are either getting the vaccines themselves or are accompanying people who are getting vaccines. Mr. Mayor?
First of all, I know that Toronto Public Health and all the other emanations of the city government, the school boards, will do everything they can to make sure, as they would have in any event, that the environment for children to receive these vaccinations is as secure as it can possibly be. For myself, I've noticed a diminished level of this kind of activity. I think it really arises out of the basic respect the vast, vast majority of Torontonians have for each other and for allowing people, while they might have differing opinions, to exercise their own choice. I can't imagine anyone, no matter how strong their views are on these issues, wanting to make pawns of children where their parents have decided that it is in the best interest of the health of those children and of the schools and of the city as a whole to get vaccinated. And so I hope that, and I think the recent behavior has indicated there's a higher level of confidence possible here, that people will let these families make these decisions and proceed ahead with their plans based on their own choice, and that people will demonstrate the kind of respect that I think we find a hallmark of our way of life here in Toronto. And I think recent patterns of behavior have been encouraging in that regard, perhaps compared to some earlier times.
Thank you. Can I continue, Lavin, here?
Yeah, go ahead.
So my final question is about the push to get 90% vaccinated here in Toronto and this holiday vax campaign. Based on the progress and trajectory, are we on track to see 90% vaccinated by the end of the year in this city? And I recognize that for some people, there are challenges in terms of getting the vaccine. But at this point, if someone hasn't gotten the vaccine with all the opportunities to get one and the opportunities the city has given people, going to their homes, going to their communities, do you really feel that last 150,000 people, that they're going to get the shot at this point? At this point, excuse me.
Said a number of times in recent months that, and I said again today, this is a marathon, not a sprint. And, we've had to readjust our own expectations, whereas in days, in the early stages of the vaccine campaign, and let's remember this incredible achievement of 5 million doses, 85% of eligible people vaccinated with 2 doses, not 1 but 2, some cases 3, has been achieved in a very short period of time. But we've had to adjust our own expectations to the fact that as you get higher and higher in terms of the numbers, that you are dealing with smaller and smaller increments of people who are coming out each day, but they continue to come. I've been at these clinics every weekend and I see the people coming in, I talk to them. And, they'll tell you various reasons as to why they haven't been before now. Sometimes it was a hesitation, sometimes it was kind of a scheduling issue. Sometimes as human beings we just put things off. And so the answer to your question is we will reach the 90%. It's hard for us to say on what day that will happen. If you look, though, at the steady incremental progress, it wasn't that long ago we were at 80. Now we're at 85. And we will push for 90, and we will get there. We are determined to get there. We're going to do whatever we have to do with regard to clinics in malls and schools and apartment lobbies and you name it. I mean, we're going to do it. We're going to get there. And it's going to be a source of great pride for this city and accomplishment when we do, because we know, and I talk to people from around the world that I'm trying to get to come to invest or to live here, and they marvel at our numbers, and we're just going to keep going because that's the right thing to do for the city, and because we know that if we keep going, we will get to where we need to be. It's a matter of determination as much as anything else. And people understand this. They have a variety of motivations and a variety of reasons for delaying, but they understand, I think, in the main, that this is a good thing to do for themselves and for their families and for the city.
Yeah, so if I can just add one point to this, Christina, it's this. For sure, as the mayor has indicated, the rise in the numbers, the increase in the numbers is not as fast now as it was earlier in the campaign, no question. But it is still increasing. Day after day after day, we are still seeing people pick up first doses and second doses of vaccine, and now more recently 3rd doses of vaccine. So exactly as the mayor says, we are just going to continue at this because we're actually still seeing progress, albeit not as fast as it was before. It is progress nonetheless.
Thank you. Next up, we have Mikhail Bolduc from Radio Canada. Go ahead.
As you mentioned, parents would prefer that their kids get vaccinated in school. So why does your plan, as I understand it, at the beginning would only include vaccinating kids in schools in 30 neighborhoods and not across the city? Is it the staffing issue? Is it the distribution issue? And when can parents expect their kids to be able to be vaccinated in their school across the city?
So thank you for the question. And first, let me make a bit of a correction. We have 30 priority neighborhoods for which there will be enhanced resources based on the data indicating the need for those increased resources. That being said, there will be school-based clinics in neighborhoods across the city from the outset. This is part and parcel of the plan. And this is over and above the vaccines that will be available at our mass immunization clinics, through pharmacies and through doctors' offices. So really, this is a very concerted effort across all the vaccination partners around the city, and it is not by any means, a restricted campaign. We are absolutely committed, along with all of our partners, to making sure that vaccine is as readily available as quickly as possible to 5 to 11-year-olds once that vaccine is approved and available for use. And we are seeking to meet the needs of our families and meet their vaccination interests in the way that they see fit, in the way that makes the most sense to them, their families, and their particular children.
Can you please clarify then how many schools we're talking about? And just the last question, how critical is it for these kids, 5 to 11, to get at least their first shot before Christmas?
So as I understand it, if I remember correctly, and my staff will have to forgive me, it is, approaching 400 different clinics that will be held at various schools. This is the kind of planning that we have engaged in with our partners in order to make sure that vaccine is available as quickly as possible to our 5 to 11-year-olds.
Okay, next up we have Tyler Cheese from CBC. Go ahead, Tyler.
Hi there. My first question is for Mayor Tory. We're hearing the province is planning on closing more assessment centers in conjunction with allowing pharmacies to offer symptomatic testing. Do you support this, and why?
Well, I am not aware of the plans they have to do that, and so when people say we're hearing things, I hear a lot of things each and every day. I think, what we've been trying to do from the very beginning when it comes to testing, and the same with vaccination, is to make sure there is a kind of balanced, accessible network of testing and vaccination places so that they can be as accessible as possible to people, and they take different forms, whether it be in pharmacies or whether it be in clinics that we've run, or whether it be in the many, many different offerings that have been put forward by our healthcare partners. And so what we'll be looking for in all of this as these new policies unfold themselves in front of us is that kind of balanced, accessible network of opportunities for people to get tested, just as we strive for the same thing when it comes to vaccination.
Okay, and my follow-up is also for the mayor, and it's switching gears a little bit. Yesterday, Premier Ford was in the city announcing more funding to fight gun violence, and then last night there was another gun-related murder at Orton Park and Lawrence. So I was hoping to get your reaction to that shooting and your thoughts on what more needs to be done to try and curb this problem that's been plaguing the city.
Well, I am, it would not be an exaggeration to say that I'm heartbroken every time I hear about one of these shootings, anytime, because it is traumatizing a family and a neighborhood, and it is not something that is welcome in any respect in our city. I think the measures that were indicated yesterday, which include things like, working in a greater cooperative manner with the province on stopping guns to come across the border, working on intelligence gathering and analytics for data of all of the things that relate to the trafficking of drugs and human beings and gang activity. These are all positive steps forward. And I spoke with the police chief this morning, and he indicated that not only are these things going to be helpful to Toronto in terms of fighting gang violence and gun violence and stopping the kinds of deaths that we have seen, but that Toronto will be a very willing participant in terms of lending resources to the province, because a lot of these initiatives are putting groups together to cooperate on a regional or provincial basis to cause these things to happen, to stop the flow of guns, to deal with in an even more effective way with human and drug and gun trafficking.
Okay, that's it for today, everybody. Thank you and have a great rest of your week.